Yeah, I want to welcome Pamela, Dr. Pamela Bell, a consultant in pain management and in palliative care. That's a broad title for you. It's not too bad.
Yes, well, I started in palliative care. Thankfully now in palliative care things have worked out that there are many specialists in that, and
Yeah,
it's no
we can do
longer part of
wonderful
mine.
things, and the wonderful things come from the chemistry of the medicines we use and from the kind of support systems, the mental attitudes we develop.
Absolutely, and I couldn't agree more with what you've said. Medicines, yes, are an important part of controlling pain, but actually supporting patients in helping themselves to manage their pain is a huge part of what we do as consultants in pain medicine.
Dr. Pamela, you're here to talk to me about a woman's health issue, and we all people sweep it on. It's only a woman's problem, but this is serious stuff. This is
Endometriosis,
endometriosis, and it's a serious problem affecting women of all ages right across the world, but certainly in Northern Ireland we have got it. Tell the people exactly what it is.
Well, endometriosis is a situation where tissue, rather like the lining of the womb, is found outside of the womb, often on the bladder, on the bowel, but it actually can spread to involve other organs. And like the lining of the womb, it is under the influence of the female hormones. And those hormones, as part of the monthly cycle, cause the tissue to bleed.
And does it do this with the atopic stuff as well?
Yes, absolutely.
So it bleeds as well as the normal cycle?
Exactly.
So there's 2 periods a month, really?
No, it all tends to come around the one time, during the time of the menstrual period. However, it's not usual to have bleeding in the bladder, in the bowel, and in the wall or in the middle of the tummy, of the abdomen. And that is very painful.
It's painful, and it's also, worrying for the woman because she doesn't know what it is.
Yes, it often presents as very, very painful, very heavy, perhaps prolonged periods.
Yes.
And often I think this is written off as, just a woman's problem. And yes, some women have heavier and more painful periods than others.
Yeah.
But sadly, in terms of endometriosis, it can take somewhere between 7 and 10 years to arrive at a diagnosis.
May I ask you to hold that thought, because we're going to take a small break now, because we have a very important person joining us, Robyn Atcheson. And Robyn is a patient in this matter. So we're back in a moment with more news of this particularly difficult problem that we're trying to cast a little bit of light on this morning. Andrew.
Welcome to Tuttle's Bar, Grill and Restaurant. Tuttle's offers a premium setting for all your corporate events or private parties. Our upstairs area comes with its own private balcony, restroom and bar. For any special occasions, both our upstairs area and garden are available for bookings. We offer an extensive range of amenities and will happily assist in making any arrangements for cakes, musical entertainment or any other services you may require. We have open bar packages with or without food options available, as well as pre-fixed menu options, which can all be tailored to suit your specific needs. Our team of professionals are ready to create a flawless event with attention to the smallest details. Tuttle's sets the standard for personalised service, from intimate affairs to large gatherings. Contact us on 646 422 7072.
Back with us you are. Yes, it's Rowan Hand with the morning programme. With me I have Dr. Pamela Bell and a patient of the condition, Robyn Atcheson. You're most welcome. You've both come a little distance to be with us today. Robyn, we were just talking about the condition and the way it presents. How long have you been aware that you're a sufferer?
I started getting pain whenever I was 13. And it took until I was 24 to get adequate treatment.
How soon did you get a diagnosis?
When I was 23.
23, so you had to wait a long time.
Yes. Yeah.
So that was a period of time of great concern, great worry for you.
Definitely, and especially because I was a teenager going through school and exams and into university and not knowing what it was and being told it was a variety of different things, or that it didn't exist at all. It was all in my head.
Yes, yes. And if I could, Pamela, ask you to remind the folk again of exactly what the situation is, what the problem is.
Well, the situation in endometriosis is that tissue that is very like the lining of the womb is found and develops outside of the womb, often on the bladder and the bowel. And like the lining of the womb, it bleeds with the monthly period,
Yes.
setting up pain and inflammation, and in fact often invading the tissues around often the pelvic wall, and resulting in sometimes long-term pain and often in difficulty with fertility.
Yeah. Has your pain gone away, Robyn?
No.
Still there? Do you manage, it's pain you're managing on a weekly basis?
On a daily basis.
On a daily basis?
Yeah. Since,
and yet you smile. Thank you. You're a good person.
Since my last operation where they removed the majority of it, I've had reduced levels of pain, and my quality of life has improved dramatically.
But is it going to rebuild again? If you have an operation to remove it, does the material, the extraneous material, present again?
Yes, unfortunately it can do. Not for everyone.
And then what's the point of doing the operation if it's going to be a recurrent thing? Need we to be looking at it in some kind of different way?
I think that the important thing is that not everyone with endometriosis requires an operation other than the initial laparoscopic operation where the gynecologist looks inside the tummy to actually make a firm diagnosis. Some women will be fortunate and will be able to manage their endometriosis with the help of their gynecologist on the basis of some hormone treatment and painkillers. Unfortunately, for some, and maybe 1 in 10 of the 1 in 10 women who suffer, that endometriosis will be more aggressive. And although not malignant, it does tend to sort of have a history or a development that is rather like a malignancy. In other words, it spreads to distant sites, and it invades the tissues locally.
And is it doing that is it doing that by way of the bloodstream, that the hormones are being sent to sites where they shouldn't be going, and that they're developing there as a cancer would? It's
difficult to know because endometriosis is possibly somewhat under-researched. And we're still not exactly sure what the mechanism is for its spread, particularly distant spread away from the pelvis. The early theories was that those women who had very heavy periods, there was some bleeding going backwards through the tubes of the womb out into the pelvis, and this was carrying some tissue with it, and that was implanting in that way. But in point of fact, we don't feel that this explains all of the problems that can exist with endometriosis. But what we do know is there is bleeding, there is scarring, there is invasion of the tissues, and because the pelvis is rich in large nerves, it can invade the nerves and cause nerve pain as well as other types of pain.
This, Robyn, is a mighty challenge that you've got in your life.
Definitely.
You know, and how are you managing it? Tell me about your systems that you have in place for managing the pain.
Well, I attend an excellent pain clinic, and the pain consultants there help me to find a treatment that suits me. I'm a student, so I don't like painkillers that kind of cloud my brain and make it hard for me to think. So every few months I go in and I get an infusion.
An infusion of?
It's called a lignocaine infusion.
A lignocaine.
Yeah, and that kind of tops me up for...
And what does that do for you, the lignocaine?
It doesn't make the pain go away, but it makes it bearable. So it kind of reduces it so that I can get on day to day.
Isn't it dreadful that we're talking about bearable levels of pain?
Yes, it is. And sadly, that once pain becomes chronic, for some of those people who suffer chronic pain, it will be lifelong. And therefore, ways of managing your life around your pain, and that includes taking medication where appropriate and finding the medication that suits you best, because while there are many, many types of painkiller out there of varying strengths and varying ways of working to numb the pain, it's often a question of trial and error before we hit on a combination of treatment that is acceptable to the patient in terms of the balance of its effect versus the detrimental effect of the side effects on their lives. And always remembering there are a lot of things that go along with chronic pain, sleeplessness, depression, you know, difficulty with relationships. All of these things are there for everyone with chronic pain, and particularly difficulties in relationships with those who have pain in their pelvis or around their womb. And I often think that those who suffer from endometriosis have a double blow. First of all, they have to deal with the chronic pain like anyone else, but also there is the risk of infertility, needing to have assistance such as IVF to conceive, difficulty in carrying a pregnancy. So all of these things for many women are an added strain,
and these are things
an added stress.
These are things that are at the very epicenter of womanhood.
Very much so, very much so. And therefore it is of concern that it takes a long time to be diagnosed. What we are hoping is that by raising awareness with general practitioners and with the public, that we will empower women to ask for help when they feel they're having difficulty with their period.
Yes.
And that the healthcare professionals, particularly the GPs, will take their worries and concerns seriously. And have a relatively low threshold for sending them on for expert gynecology care.
Yes. Robyn, in your case, when you went to the GP at the start of your voyage of discovery about this endometriosis, I managed to say it, goodness gracious, what was the response? And how long do you think it was in that journey before you were taken seriously?
Well, when I first went as a teenager, I was told that it was normal, that all girls go through this.
Oh, I see.
Eventually, they put me on the pill to help with my heavy periods, but it wasn't until I turned 18 that I could get sent to a gynecologist, they told me. So as
Is that so?
Not really so.
No, that's what I thought.
Although I would have to say that gynecology is largely an adult service.
Yeah, but adulthood comes
relatively
with the commencement of puberty.
Exactly.
So 18, people reach puberty long before 18.
Indeed, and there is this gap in the service between, let's say, 12 or 13 and 18, when relatively few young women get referred to gynecology.
So when did the picture begin to come into focus in your journey with your GP, Robyn?
When I was 18, I was sent to a gynecologist, and from there I was sent for various scans. I was diagnosed with polycystic ovaries. I was put...
And was that an accurate diagnosis?
Well, they saw cysts on my ovaries, so I
and they were assuming it was a polycystic thing.
Yeah. They put me on treatment to stop ovulation, so I went through an artificial menopause when I was 22, and it wasn't until I finished that treatment early, because it made me worse, and I was hospitalised for over a week, and they told me that it was in my head and I needed to see a psychiatrist.
Oh my God.
And it was at that point that I started fighting back and started asking and kept on going.
Of course, these were days when the word cancer would have been in your mind. You would have been worried in case it was something like that.
Well, my mother had endometriosis.
Ah, so you had a little bit of information.
Yes, and she had to have a hysterectomy very young, and we kept telling doctors this, but they just, I was too young to have endometriosis, was what they kept saying. And
what have you been told the prognosis is? Have you got to get used to the idea of it continuing as it is now, or getting worse? Or what's your best hope for your future?
Well, I'm hoping to keep the pain kind of manageable until I'm ready to have a family.
Yes.
And
thank God that will be possible.
Hopefully.
Hopefully. That's good.
But long term, like a lot of the other women who are in the endometriosis support group that I'm a member of, A lot of them only find relief once they've had a hysterectomy.
Yes.
So long term, I have to prepare myself that that may happen one day. That's the only way to kind of get rid of it.
But sure, if that happens when it happens, perhaps you'll have your family by then.
Yeah, hopefully, yeah.
And that's it's dire enough, but it's not the end of the world if it has to happen, and that would be the thing. The support group. We talked earlier about the need for kind of a good attitude. How important is Pamela, is the support group?
The endometriosis support group is a wonderful organisation. It provides a forum where women can, in confidence, share their worries and concerns, support each other when they are going through what is often a whole string of different treatments, including for a few multiple surgeries. And
multiple surgeries, isn't it, Fred?
It is.
Yeah.
In a sense, it is dreadful that you have to have many. Some have to have many operations.
Yeah, yes.
On the other hand, surgery at the right time can sometimes improve chances of fertility.
Yeah.
And so many women.
That's a price worth paying.
That is worth paying for some, for many indeed.
Yes, of course.
Unfortunately, although I would stress not a malignant disease, it does tend to come back. So that having cleared...
The same hormones that generated in the first place are going to generate it in the second place.
Exactly.
Yeah.
Exactly.
Yeah.
So sadly, one can't always promise that one operation will be the end of it for you. And sadly, for some people, even after hysterectomy, the pain will continue due to the damage caused to other organs and in particular to the pelvic nerves.
My goodness. The state of research at the moment, what's happening there?
I'm probably not the best person to speak about this as a pain consultant rather than a gynecologist.
In the run of things, are you aware of a solid kind of swathe of research going on at universities across the world?
I think that what has been really very key over the past number of years has been the development of specialist endometriosis centres in the rest of the UK. And this has provided a forum for research and training and understanding and support for people with endometriosis. And so one of the things that we're very pleased about is that all the work that the Pain Alliance have done with the endometriosis support group and others over the past year has resulted in endometriosis per se being included in our commissioning plan for health for the first time
That's wonderful.
ever.
That's a huge step.
And we are moving towards the establishment of an endometriosis centre for Northern Ireland.
Wonderful. That's a huge step
Which
forward,
has been
isn't it, Robyn?
absolutely wonderful, and I'm really pleased that we've had the support of the Assembly Health Committee, of the Minister in the Department of Health within the past year.
Yes. Yeah.
And this has been a tremendous step forward. And as I say, now that the commissioners at the Health Board are excited to move this issue forward, and the Public Health Agency have come on board as well, I think that we'll see much improvement in terms of public understanding and training for those in the health professions. And I hope that within a very short space of time, women who suffer endometriosis will begin to see a difference.
Wouldn't that be fantastic? Because from my point of view of not knowing anything about it, there is one element of logic coming into it. And the element of logic seems to me to be, to a totally lay mind, hormonal balance in some kind of way. And that research looking in that direction might bring something forward, because it's hormonal centered, isn't it?
It is, absolutely. If there were no female hormones, there would be no problem, I think, with endometriosis. But sadly, this is how life is for women. It's very necessary that the womb be prepared each month for the possibility of conception.
Yep.
And endometriosis is just a very bad downside of all of that for those 1 in 10 women who suffer.
And as I said to you at the beginning, I've been in journalism 50 years now, And I never, ever, ever, until you mentioned, until Sarah put it on the board, I didn't know what it was. So somebody's not telling the story.
I think that up until now the story hasn't been told loud and clear. Obviously, gynecologists have been very aware of it. Those who've eventually been diagnosed have been aware. General practitioners have to some extent been aware, but perhaps haven't really felt able to distinguish those who have normal period pains and normal periods from those who have heavy periods and severe period pain. And I think there's a bit of work to do around how we identify out of that group of young women, such as Robyn at the age of 13 or so, who's having troublesome periods, how many of those are actually suffering from the early stages of endometriosis, how many of those are going to go on to become very severe, because not everyone will become severe, thankfully, only 1 in 10 will develop the most severe forms of the condition. And knowing early allows early intervention, but it also helps, I think, people to think of their life going forward and thinking about perhaps how they might wish to plan a family, particularly if they have found their life partner.
Yes, of course. But that's another area of, I think we men, Pamela, don't really, we haven't even started to understand women, because what women come through on a constancy basis, and this is part and parcel of it, we can't get our heads around it at all. And maybe it's a wider knowledge, a more sympathetic observation post for men to try and understand a wee bit more, and to realise that you're not just being cussed and bad-tempered, but that you are struggling with dreadful pain, you know.
Yes,
we have a lot to learn.
Pain has a really detrimental impact on mood.
That's what you were saying, yeah.
And I had so many patients over the years who said, you know, particularly around their relationship with their family, that sometimes they'd, if they like, bitten the head off the children.
Yeah, of course.
And as soon as they'd done it, they wanted to take it all back and you know, help their child to understand that, you know, mum's struggling, and she really didn't mean it. And that's on the mild end. Those who suffer from long-term pain often end up with depression and anxiety that would be described as clinical.
Is there any evidence at all that it is country-specific, or where is there a geographic? Does it happen in the developing world?
It happens everywhere.
Everywhere.
It happens everywhere. Perhaps in the developing world it is a little less prevalent, where there are still large families and where childbearing starts very young.
Can be as young as 13.
Can be in some developing countries. And there is some thought that perhaps bearing children may mitigate some of the effects of endometriosis. Sadly, from the point of view of those who suffer from endometriosis, over the past 20 years or so, there has been in society a tendency to have families later. When I was a medical student all those years ago, one fact stuck in my mind, because at the age of about 23 myself, we were told that in terms of health of infants and children, that the healthiest babies born in Northern Ireland were the second children of 23-year-old women. And myself and my girlfriends in medical school rather smiled at that, because we hadn't even thought about settling down at that stage.
You're in the beginning of a long journey.
But clearly there has been a shift, and it might be now more common to have one's second child at 32 rather than at 23. And so, you know, people like Robyn want to have their careers, their education, their careers, establish themselves, find their life partner, and then begin to settle down and think about children at a much, much later age than would have been true 20 or 30 years ago.
Robyn, within yourself, how are you feeling? You know, if you know the term, just you're struggling with pain on an ongoing basis, but that doesn't completely debilitate you. You have good attitudes to life, you reach out. How do you manage on a day-to-day basis? Say on a scale of 0 to 10, 0 being totally unbearable and 10 being pain-free and life perfect. Where would you be on that scale?
I'm normally somewhere around the middle, but it's all to do, what I find helps is all to do with pacing. So if I know I have something big happening tomorrow, I'll do less today to save up energy. If I know I'm going to go away for a few days, I need to take some time when I come home to let myself settle back down again. And for me, it's about pacing and having backup plans. I can't do things at short notice. I need to know exactly where I'm going, if I can take my medication, if I need to, if there'll be facilities for me to make a hot water bottle or put something in the microwave like a heat pack.
Does that help if you hold a hot water bottle to your tummy or to your back or something like that?
But before I was diagnosed, I was using a hot water bottle so much because I was in so much more pain then that the skin on my stomach actually started to burn. And when I went to doctors, they would say, well, there's the problem, you're burning your own skin. It was turning black and it was bleeding, but that was just the only thing that helped at the time.
Does going to bed and going to sleep give you respite?
It does, and whenever you can get to sleep.
When you can get to sleep.
Yeah, I'm quite lucky. I can sleep quite well, but I know other girls in the group who have trouble kind of finding a comfortable position. More than anything else, and most of them will sleep with a hot water bottle or.
Goodness gracious! Well, our thoughts are with the pair of you, and wishing you good luck in all that you're doing and trying to achieve. How do people contact you if they're worried? What's their best pathway towards care?
And if they actually suffer from endometriosis,
maybe they don't know.
I think the best thing to do is go and talk it through with your general practitioner.
And to mention the word.
And mention the word, and ask for a referral on to gynecology. If your GP feels perhaps a little reticent, they may need a little prompting to do that. Please don't accept that it is normal.
It's important to remember that.
That is very important.
You know, you're not visiting the GP because it's normal. You're there because there's something abnormal. And in reality, you are the organizer of your own well-being. It's not, you have the responsibility to look after yourself and to assume that no one else is going to do it as well. So you must take the initiative.
Taking the initiative is important because as you go through the whole process of diagnosis and managing your endometriosis and its pain and the fertility issues that arise around it, you're going to need to feel empowered to help yourself if you're likely to have a good outcome.
That sounds good.
Unfortunately, just depending on others to do everything for you is not necessarily going to be the best way forward.
Dr. Pamela Bell, thank you very much indeed for coming in. And Robyn, Atcheson, thank you for coming in. We wish you well.